Hi guys, Heather here. Hope everyone is having a good fall season so far. Today we're going to continue our discussion on the Chem 7, the importance of these labs, and how to be familiar with them when taking care of your patients. And one very important lab that needs to be within normal limits is the potassium. Normal potassium levels should be between 3.5 and 5. Potassium is needed for function of the cells, smooth and skeletal muscle contraction, and especially crucial for proper cardiac muscle function. If your potassium is not within normal range, there could be a possibility of irregular heart rhythms. And if it's too low or too high, it could lead to cardiac arrest. So if you're working on a telemetry floor and you call the doctor up because your patient's having some VTAC, they'll usually ask you what the K and MAG levels are. And also, after open heart surgery, it's normal for the surgeon to order MAG and K replacements to prevent possible dysrhythmias. Sometimes patients can go into a dysrhythmia called AFib after surgery, so we want to make sure their MAG and K levels are within normal limits. Potassium can be given in pill form or IV. If given IV, it shouldn't be given faster than 10 MEQs per hour. So a 40 MEQ bag of potassium will go over 4 hours. And it should never ever be given IV push unless you want to send your patient into cardiac arrest, which I don't really recommend doing. And this reminds me of a story. Have you ever seen those potassium pills? They're enormous. I don't even think I could swallow one. So one day my patient didn't want to take her potassium and she asked if she could just eat a banana instead. And I was kind of curious to find out how many bananas she would have to eat to equal the 40 MEQs of potassium that the doctor ordered. What I found was that a banana has about 11 MEQs of potassium. So she would have to eat almost 4 bananas to equal 2 horse pills. And that's not even the highest source of potassium either. Tomatoes, potatoes, and even raisins have higher potassium. But the best source is in an avocado, which has about 38 MEQs of potassium. Or you could feed your patient seaweed, which I read was high as well. Do any of you guys eat seaweed? I read that Jennifer Aniston eats seaweed salad, which helps her metabolism. I might have to try that someday. But I digress. 80% of potassium is excreted through the kidneys. So that's why if your patient's on Lasix, guess what? Their K is going to need to be replaced. And the other 20% is excreted through the bowels and the sweat glands. So that's why if your patient's K is high, the doctor will most likely order K-Exilate, which is a laxative. Nice, huh? Not really. Well, that's it for today's potassium lesson. I'll talk to you soon, okay? And have a great day. Bye!